Hi, I'm Dr. Edwin Williams, a board-certified facial plastic surgeon from New York who has, we have an office clinic in Latham and St. Thomas. And what I'm here today to talk about in our fireside chat is how to avoid a facelift. It's a pretty common problem, and patients, I happen to do a lot of facelift surgery, that's my practice, but one question I'm always asked is, are there other options out there? How do I avoid a facelift, and how do I preserve what I have? Now, some of these things, quite honestly, are just common sense, and others, there's areas of confusion. For example, it's a statistical fact that those people who have moderate their alcohol consumption live longer and look better. It's the same thing with sun exposure. If you take a look at your arm and flip it over and look at this side versus this side, or you take a look at someone who drives a truck for a living, and you look at the left side of their face, there's considerably more facial aging. All of these things go against what we're trying to do as far as longevity and helping us look better longer. Stress is another big factor. One of the things I tell our patients is that if you can moderate your stress, that's a very good thing. Look at our presidents when they go in office and when they go out of office. They almost look like different people. So moderating stress is very, very important. The same thing with nutrition. Keeping your body weight down, eating good nutritionally, and I know this sounds silly, but regular and consistent sleep. People who get to bed at the same time and wake up at the same time look better and age better. And as I mentioned, sun exposure is another big factor. Now, to get into the topic of how to avoid a facelift, one question I'm often asked about by patients is, what about facial exercises? Is there anything you can do to preserve or put off a facelift by doing facial exercises? Quite honestly, it's just the opposite. If you take someone who's been paralyzed on one side of their face for their whole life, compared to the other side, the side that's been paralyzed has no wrinkles and less sagging. So in other words, the wrinkles are constantly pulling on the skin. So facial exercises are absolutely not what you want to do. Now, we don't want you to stop having fun and smiling, because that's part of life. But to think that facial exercises are going to put that off is kind of silly. So I would avoid trying to do facial exercises. And I know there are a number of different products out in the market. Good skincare is important as well. But let's talk about two really hot topics out there, and that's CoolSculpting and Kybella or Kythera. Now, Kybella is a deoxycholic acid, which is basically a biosalt that is injected in this area. It's been FDA-approved since April of 2015, just last year. I'm one of the trainers to train other physicians. I went down to the original training, and as a facial plastic surgeon having a lot of experience in facelifting, this was intriguing to me, because is there anything we can do to treat the neck? Now, Kybella and CoolSculpting both treat the neck area. Kybella is an injectable. Your doctor measures and figures out the amount of dose based on their training to inject in this area. And what it literally does is, over the period of several weeks to a month or two, it melts the fat. And double chins are a big concern for a lot of individuals. And so I think there's a tremendous amount of interest in this. The other option is CoolSculpting. CoolSculpting works as well. And what that is it's basically cryotherapy. There's a CoolSculpting device that goes on, and we actually have a little video on our website. But what it does is it freezes the fat in this area. Now, both methods, the injectable, Kybella, and CoolSculpting, do remove the fat or kill the fat cells. In other words, they don't come back. If you were to go ahead and try to gain a little weight, those fat cells are gone. So you will put the weight on a different area. So both of them are effective. The other option is liposuction. And A lot of patients are opposed to liposuction or lifting. In my opinion, when I'm doing a facelift, liposuction is still the better option. And I'll tell you why. Because the CoolSculpting and the Kybella are relatively expensive. I'm not sure where the market is going, but I do know they both work. Kybella, for example, the average individual needs at least 2 and possibly 3 treatments, and typically we do them a month or 2 apart. The average range of expense is somewhere between $1,000 and $1,200 or $1,500. Sometimes $2,000 or $3,000 if someone has a lot of tissue in here. CoolSculpting is a little less expensive, but the downside to CoolSculpting is some people are not good candidates because there's a little device that you snap on here to see if you can get that fat in there to melt the fat, and some people are just not good candidates. So we really have 1 or 2 options here. We have either Kybella or CoolSculpting aside from surgery or lifting or liposuction. There are some individuals that have a lot of tissue in their neck that, in my opinion, the value is not there for Kybella, because now you're starting to look at the cost of multiple treatments with a lot of tissue, and you're really getting into a range where someone's better off having a lift. Now, there are some people that will just never have a facelift. I mean, I've had people that come in, and when you give them the numbers, they say, you know what, I know that's a lot more money, $6,000, $7,000, $8,000, because I have a lot going on, but doc, I'm just never going to have a lift. I'm one of those people. Then there are other people that say, okay, if you were me, what would you do? And there may be a better value long term to have a lift. I hope I've answered some of your questions on how to avoid a facelift. Basically, there are a few different options, and we thank you for taking the time to listen to our video.